Hi, I'm Dr. Lauren Hacker.
I'm Dr. Kelsey Asplin. We are from the Denver Naturopathic Clinic and thought we would put out a little video about coronavirus in case you haven't gotten tired hearing about it.
Mhm. We're going to be covering symptoms and populations affected, as well as why the recommendations are the way that they are, what our clinic is doing about it, and ways you can support your immune system moving forward. So the first thing that we wanted to touch base on was symptoms. We're sure that you all are very aware of the symptomology at this point. We are seeing cases with a dry cough mostly, and then occasionally a low-grade fever, although that is occurring in about 40 to 60% of cases. The fever is lasting anywhere from 2 days to 7 days. And then we also have a characteristic shortness of breath, so respiratory difficulties, and definitely a progression towards respiratory difficulties as the illness moves along. While these are the main symptoms and definitely most common, there have been reports of other upper respiratory type symptoms, so runny nose and a tickle in the back of the throat are also possible symptoms you could be experiencing, although not in the majority of cases.
Great. So then I also want to talk about population. So you guys have almost certainly heard that the people who are most at risk for this virus are those who are immunocompromised, those with cardiovascular disease, blood sugar disorders like diabetes or renal disease. But something we just want to make sure everybody's aware of is that these are not the only populations of people who have a likelihood or any amount of risk in getting the virus. What we're seeing as more and more data comes out on a daily basis is that anybody really can get this. Those who are immunocompromised or have these chronic diseases may be at greater risk of complications or of the disease progressing, of the virus progressing rather. But it is so far looking to be pretty fair game across different populations, men, women, different disease states, different age groups. And so we just want to dispel any myths about that and make sure that everybody knows that they are potentially at risk for contracting this if they are in the vicinity of somebody who has it.
And especially spreading it too. So being aware that even if you are in a younger population group, that you can still be a carrier to somebody who you don't know is immune compromised or in a higher risk population.
Right. If you have symptoms that maybe aren't so bad, that are more mild or moderate, you can still carry it and create a problem that's much worse for somebody else.
So we also wanted to talk a little bit about the recommendations and why they are the way they are. So definitely you've heard a lot about washing your hands and the ability to use soap and water to break up the adhesiveness of the virus to your skin and to reduce the transmission from your hands to your mucous membranes. And then as well as social distancing being the big one right now. So staying away from people, and when you are in public spaces, like if you need to go to the grocery store, trying to stay at least 3 to 6 feet away from people. The reason that we're seeing, especially the social distancing, is because the virus, which is moving at rates that we haven't seen before, can be transmitted in 3 different ways. The first way being through surfaces. So if somebody who has the virus comes into contact with a surface and then you touch that surface and touch your face, you can pick it up that way. Another way that you can get it is through if somebody is coughing or sneezing and those particles are spread throughout the air of a room. I think Dr. Kelsey said earlier how long is it? It's lasting 3 hours in the air right now.
Yeah, the thought is that it can actually last 3 hours in the air in those water droplets.
And then the major route of transmission being the respiratory droplets in contact. And so that is like breathing, just as you breathe, you're releasing respiratory droplets anyway, but also coughing and sneezing. And then if you're in close contact with someone, so less than 6 feet, you can also be transmitting it to them at that point as well. And we all know, we've seen studies where sneezes project way further than we realize. They definitely project much further past 6 feet. So being cognizant and socially distancing yourself and washing your hands. And yeah, so we'll talk a little bit more about what our clinic's doing.
Yeah, so at our clinic, we are trying to, I think our mission is a couple different things. So we are not closing our clinic because we do want to make sure that we are open and available to the patients who need us. However, we have changed the structure of our patient care a little bit at this time. So we are asking all of our patients to call first rather than just dropping in to pick up any of their products or to speak with one of the providers. We are offering all of our patients to do teleconferencing or video conferencing for their appointments so that they can stay home and stay in an environment that's a little bit more controlled for them. We are coming into work as we see fit and necessary. We are also trying to make sure that we are directing our patients to the resources that they need. So we are trying to put out a lot of resources on a regular basis for anybody, not just our patients, but for people who visit our website, for people who subscribe to our email list, just so we can make sure you're getting up-to-date information as we're getting it. We do make sure that our office is regularly cleaned. So we're doing all of the things ourselves, but we're also trying to make sure that as healthcare providers, we are balancing between being available to the patients that need us and also following the recommendations that have been set out by the CDC as well.
And we're continuing to provide the best care we can regularly for our patients outside of this as well, and also continuing to assess our role in the current medical situation as that continues to evolve.
Yeah.
So we wanted to talk also about basic things that you can do at home to support your immune system. And then we will probably get into a little bit more later this week about specific herbs and nutrients that you can use to support your body as well.
Yeah, so we actually created a free PDF download that's on our website. So you guys can all go grab this if you go to our website, which is denvernaturopathic.com, and just click through the main head banner about coronavirus. You can download that guidelines or those guidelines from us, and you'll also get subscribed onto our email so that you won't miss any of the stuff that we're sending out about this. But a couple of things we want to touch on really just comes back to your foundational health practices. And all of these are things that you can do at home for little to no cost to support your immune's efforts to try to keep you strong. So the first couple I want to touch on are just hydration and food. Making sure you're staying well hydrated is really important. It's important anytime, but especially when we're talking about keeping your immune defenses up and helping you battle any kinds of viruses or bacteria that are in your environment. Because water gives our cells energy, and it actually helps us to flush out any of the toxins or the leftover waste from our immune system battling anything that it comes into contact with. So making sure you're staying really well hydrated so you can flush your body, make sure you're getting enough electrolytes can be really, really helpful. In terms of nutrition, I think it's really important that we talk about this right now because so many people are trying to make sure that they have enough food in their cabinets. But really the type of food I want you to be focusing on are things that you can cook at home yourself rather than frozen or quick prep meals. Right now is a time that it's so much more important that your body has as good of nutrients as it possibly can. Your cells need nutrients to fight the good fight. And so trying to eat organic whenever possible so that your body's not diverting energy to trying to detoxify any of the pesticides or herbicides that's on that product, which can also impact your gut flora, and your gut is really where your immune system is housed. So trying to eat as clean as possible, trying to eat as many colors as possible so that you're getting all of the different phytonutrients you can in from all of your fruits and vegetables, making sure you get adequate protein so that your body can actually maintain growth hormone and immune regulation and turnover and cellular regeneration processes. So all of that's really important. And the other thing is, I would say right now when we're stressed out, it's really easy for people to turn towards caffeine and sugar. And I would really advise against this right now because when you do that, caffeine and sugar are both inflammatory. And so they actually require your immune system to divert some of its little troops over to dealing with that. So then you lose some of your additional reserves in case you actually come in contact with the virus. So focusing more on clear liquids like water, broths, herbal teas, and then just eating really nutrient-dense foods are some of the best things you can do right now.
And some other things that you can do that are easy and accessible for you at home is to make sure that you're getting adequate sleep. So what we mean when we say adequate sleep is practicing great sleep hygiene at the end of the night. So trying to go to bed as early as possible, and even just getting into bed early and maybe reading, trying to leave screens, so TVs, laptops, and cell phones either turned off an hour before bed or in the other room, reducing that blue light exposure to your eyes, which can stimulate your pineal gland and break down the melatonin, which helps you sleep. Sleep also helps reduce inflammation in the body and reduce stress levels, so your cortisol hormone levels in the body, and regulates other neurotransmitters and hormones in the body. And the general recommendation for sleep is about 7 to 9 hours of sleep for adults. And so really aiming for about 8 hours, 9 hours if you can, is really helpful and supportive for all your body's functions, repairing cells, and removing waste products. Additionally, getting movement is another great free resource. So whether you are running around, chasing your kids around the house right now, or getting outside and practicing getting fresh air and walking in nature and being socially distant from your neighbor who's walking on the other side of the street, a little bit of that connection, but also keeping distance and enjoying nature and fresh air. Those are really great ways. There's also tons of available YouTube videos and free workouts and free workout apps that are available. So you can raise your heart rate or get your body sweating and eliminate those toxins. And then the other thing too that we wanted to talk a little bit about as well would be stress reduction practices. So in this time, a lot of our colleagues have talked about not panicking and reducing fear responses, and really just practicing love and compassion both for yourself and for the other people around you. You can use hand washing as a self-care practice to just really quell the panic and fear that stimulate the sympathetic nervous system, stimulate that stress, fight, and flight response, and increase your stress in that way as well. So breathing, meditation, qigong exercises, yoga, those are all great stress reduction practices. Mindful walking, mindful eating, also really great as well for inducing that parasympathetic state and helping your body optimize its defenses.
Right. And then finally, I just want to touch a little bit more on the social part of this. And I think this overlaps a lot with what Dr. Hacker was saying in terms of our mental health, is that, you know, we are being told that social distancing is important right now. It absolutely makes sense that it is important. And so we do recommend that people follow through on that. But we also know through research that being socially isolated can actually increase the inflammatory responses in your body and can lead to more mood issues, more lethargy, more fatigue, and more depression and anxiety. And so what we would recommend to combat that right now is, like, remember that just because you're socially distancing doesn't mean that you can't still reach out to your family and friends. So using your phone, doing video or teleconferencing, doing group conferencing, so you can still see people and talk to them in real time, even if it is on a screen. We talked about doing things that reduce inflammation in your body, like yoga or Tai Chi or Qigong. And all of these are things that you can follow an instructor on YouTube. So you can still get some of that personal interaction. These are great activities that you could get your whole family to do with you, that you could try to get your dog to do with you. So there's a number of ways that you can still stay connected, even though you are physically separated from those around you. So we think these are really important. These are all things that they may seem simple, but they actually can make some of the biggest difference in keeping your immune system strong and helping support you through this time.
Yeah. So again, we just wanted to invite you to please click through our website. You can read the blog posts. You can follow both our clinic and Dr. Kelsey Asplin and myself, Dr. Lauren Hacker, on Instagram. We are doing the best we can to learn as much as we can and synthesize it down into bite-sized chunks for everyone, and continue to turn over our resources as more information is becoming available in order to support you in the best way possible. And then like Dr. Kelsey said earlier, going online and you can go on our website and download the PDF on coronavirus and learn how to support your immune system from home. So you also can, through that PDF, sign up for our newsletter, and we will be sending out updates throughout the week and in the coming weeks of more recommendations and great things you can do.
All right. So thanks for tuning in, and stay tuned for more.
Thanks. Have a good day.
Bye.
Bye.